Most people think nearsightedness just means needing glasses. But what many people don't realize is that higher levels of myopia can actually increase the risk of retinal detachment, a potentially sight-threatening emergency. So why does that happen? And how do you know when flashes, floaters, or blurry vision could be something serious? Let's dive in. The retina is the thin layer of tissue lining the back of the eye. You can think of it almost like the camera sensor of the eye. It captures light and sends visual information to the brain. A retinal detachment happens when the retina pulls away from the back wall of the eye. When that happens, the retina can no longer function properly. Without treatment, this can lead to permanent vision loss. That's why retinal detachments are considered medical emergencies. But here's the thing, the first question we need to answer is, why is someone nearsighted? The biggest reason has to do with the shape of the eye. In nearsightedness, especially higher levels of nearsightedness, the eye is usually longer from front to back than normal. As the eye stretches and elongates, the retina also becomes thinner and more fragile. Imagine stretching a balloon. The more it stretches, the thinner the surface becomes. That stretching can make the retina more vulnerable to weak spots, which can become holes, tears, or retinal detachments. And once a retinal tear develops, fluid can sometimes pass underneath the retina and cause it to detach. People with high myopia are also more likely to develop changes in the vitreous gel inside the eye. Now, the vitreous is the clear gel that fills the center of the eye. It serves mainly as a shock absorber. But here's the thing, as we age, that gel naturally shrinks and pulls away from the retina. This is called a posterior vitreous detachment, or PVD. Most of the time, this is normal, but in some cases, the vitreous can pull hard enough to create a retinal tear, especially if the retina is already thin from myopia. Now, this is the part that's really important. Symptoms of a retinal tear or detachment can include sudden flashes of light, a sudden increase in floaters, a dark curtain or shadow in your vision, missing some of your side vision, or sudden blurry vision. So if we have any of those things, we really need to be checked out sooner rather than later. Now, not every floater is dangerous. Many floaters are harmless and common. But if you suddenly notice a large increase in floaters, especially combined with flashes of light, you should get your eyes examined as soon as possible. The earlier retinal tear or detachment is found, the better the chance of preserving your vision. In clinic, I get asked if every nearsighted person gets a retinal detachment. No, not at all. Most nearsighted people will never experience a retinal detachment, but the risk does increase as myopia becomes higher. That's one reason regular dilated eye exams are important, especially for people with moderate or high myopia. It allows eye doctors to check for weak retinal areas before they become more serious. But here's the thing, if we do end up with a retinal detachment, we do have treatment options, but treatment depends on how severe the problem is. Small retinal tears can sometimes be treated with laser procedures to help seal the retina down before a detachment occurs. But larger retinal detachments often require surgeries, sometimes taking several hours. And timing matters. The sooner treatment happens, the better the visual outcome tends to be, especially if we can do the surgery before the macula becomes detached. That's why symptoms like sudden flashes, floaters, or a curtain in vision should never be ignored. So while nearsightedness usually starts as a simple focusing problem, higher levels of myopia can stretch and thin the retina over time, increasing the risk of retinal tears and retinal detachments. That doesn't mean everyone with myopia will develop one, but it does mean knowing the warning signs is extremely important. If you found this video helpful, consider subscribing because I post videos about eye health, vision, and eye diseases on a weekly basis.